Welcome back. The Supreme Court takes up a landmark case today as transgender youth challenge Tennessee's ban on their medical care. The justices will weigh whether constitutional protections against discrimination extend to transgender rights, a decision that could affect similar laws nationwide. The case centers on access to treatments like puberty blockers, but legal experts say it could set precedent far beyond just medical care. A new survey, meanwhile, finds most Americans need a balance of socializing and solitude during the holidays. Yes, that's right. More than half of people say alone time is vital for their mental health, but nearly half get less of it during the holiday season. Mental health experts recommend making time for activities like exercise, meditation, or just listening to some music to help manage that holiday stress. The risk of developing cancer rises with age, but an increasing number of younger people are being diagnosed with the disease, according to the American Cancer Society. One cancer in particular is most often found among young men. Mandy Gaither explains why it's important for men at every age to be aware of testicular cancer signs.
He's an Ohio State University sophomore and a proud member of the Buckeyes marching band. But last semester, Grayson Nemi knew something wasn't right with his body.
Some soreness and just enlargement, and then eventually feeling a lump like while showering.
At first, Nemi says it was thought to be a cyst, but an ultrasound and further testing revealed the lump was something else. Testicular cancer, and the disease had spread. He was just 19 years old.
And it was definitely just scary, especially with the type of cancer I had. It can impact reproductive health.
It's estimated that about 1 in 250 men will develop testicular cancer in their lifetime. For the most part, it affects young and middle-aged men, with the average age of first diagnosis being around 33 years of age. But about 6% of cases happen in children and teens.
These guys are usually healthy. And so I think what the message should be is if you see something, say something. If something's abnormal, let somebody know.
Nemi's medical oncologist, Dr. Paul Monk with Ohio State's Comprehensive Cancer Center, says early detection of diseases is always important. Symptoms can include a painless lump or swelling in a testicle, change in size or shape, a feeling of heaviness, or a dull ache in the lower abdomen or groin. But there is effective treatment, and because of that, Nemi is back out doing what he loves. He's now cancer-free.
If there's a symptom, definitely get it checked out as quickly as you can.
The American Cancer Society says for the past several decades, more men are being diagnosed with testicular cancer in the U.S. and many other countries, but the cause is still unknown.